Welcome to Ask Melissa Almost Anything for another noon hour edition in the Eastern Time Zone, where we talk about your life and your body, where we believe your health is your responsibility, where we believe you have a choice in your healthcare. Oh, and how you spend your healthcare dollars. But most importantly, we believe pain is not normal. I'm your host, Melissa, here with Nephew Physical Therapy. Today, we're talking about neck/shoulders. Now, the reason I say neck/shoulders is one of the most common, and I want to be really nice to all my physician friends, misdiagnoses of shoulder blade pain actually is due to the neck. It's one of the most important things, and I'm going to start with that today because it is one of the messages that I think that makes the biggest difference in how fast we get to the care that we need. Now, of course, today we'll talk a little bit about posture. We'll talk about migraines. We can talk about your kids and maybe they're getting too much screen time. Put your questions in the comment section. We'll answer them as they show up. But what I really wanted to start off today with is that pesky shoulder blade pain. The reason I can talk about it as an expert is not only do I treat it, but I have had it. What it will often feel like is really like this deep, deep ache right along the border of your shoulder blade that you just can't get to. And what you'll notice is you'll know that it's coming from your neck if, in fact, you can change that with the position of your neck. It's one of the key differentiating diagnostic tools that we use as physical therapists is when we're assessing, is it neck or is it shoulder? We are deciding that based on if we can turn the pain on or if we can turn it off, which is why we will always ask you what makes it feel worse, what makes it feel better. So if I, in fact, am having issues down my shoulder blade, that pain will change when I flex all the way forward and or when I look all the way up. What it's letting me know is, in fact, that pain along my shoulder blade due to some type of nerve being impinged as it exits my spine. If I can move my shoulder every which way from Sunday, reach behind my back, all those things, we can tell that it is not your shoulder that is responsible for said pain and or the possible injury you think that is associated with it. We are looking for, again, the signs in regards to range of motion. And that is something that you can get to much faster. For example, just the other week, we had somebody personal message us here on our Facebook page that said, pinched nerve and neck causing shoulder pain and numbness down the right arm. Had an MRI on the shoulder, nothing wrong with the shoulder. Help. That's the question we just received. So my response was, for sure, it sounds like it could be a classic pinched nerve. And the results of the MRI actually make perfect sense. What you may also know, and I want everybody to hear this, is that in fact, many MRIs, whether we're talking about knees, shoulder, neck, sometimes those MRIs come back negative. Negative for what they're looking for in regards to something surgical. I want to say just because there's a negative MRI does not mean that you don't have symptoms. It doesn't mean that you don't have pain. Because it just means that there's something that isn't indicated on the MRI that is something torn, something broke, right? Something inflamed. So when we have numbness and tingling, right, or we have radiating pain, that is sometimes obvious, right? It goes down the arm, and we, again, can turn that on or off with the neck. The shoulder blade, though, coming back around to that, is just a little bit different because it won't feel necessarily like numbness and tingling. It will feel like that deep ache. And it's why I do not, hear me clearly, do not recommend stretching your neck to improve your symptoms. We sit a lot, okay? We sit way more than we should. We all know that. Some of you are better at getting up and taking breaks than others. But when we sit, what happens to our posture? Right? I almost fall off your camera screen because I'm so rounded and forward. So Why would I, and this is where I'm a critical thinker here, friends, why would I then stretch my neck forward if my neck has been forward all day long? Good question, right? Why would I reinforce a position that is already something I'm in too much? As a physical therapist, my answer is you don't. Okay. If you've joined us for any of our previous sessions, or if you're seeing anything that we're putting out there in our newsletters or on social media, or again here on Ask Melissa Anything, almost anything, we're talking so much about the importance of extension. Okay. Bending backwards, chin tucks, right? Let me give you all those extra chins, right? It's really my best look, friends, really. Chin tucks, because I need extension in my life. I don't need to be bent more forward, because when I'm treating patients, I'm bent forward. When I'm sitting at my computer, I'm bent forward. When I'm riding in the car, I'm bent forward. So much flexion, so much bent over. So why would I stretch my neck forward? Well, I think the simple answer is people say because they feel tight. But again, we have to be critical thinkers and ask ourselves, am I actually tight? What is going on there? So let me show you one of the simple tricks that I do when we're working with a client to figure out if their neck is in fact tight. Is it a shoulder issue? Is it a neck issue? So sit up nice and straight with me, friends, right? Sitting up nice and straight. If I put my hand right on the top of one of my shoulders, okay? Or do it to the person sitting next to you, as long as they say that that's okay. But I will have my clients set their hands right on top of my shoulder. And so when that hand is sitting here, it feels nice and loose. What happens when I go forward and round? It feels taut. It feels really tight. So the question is, do I need to stretch that to make that looser here? Or, oh, wait a minute, if I sit up straight and I pull my shoulder blades together, I can make it looser. So what do I need? I need strengthening. I need to be stronger between my shoulder blades. I need my chest to open up. I need flexibility in my chest. I don't need to be more bent forward. I need to be more upright. And stretching the neck in most situations is not what's going to make you feel better. And it's also not going to reinforce the proper posture that you're looking for, that you need to survive modern American life. So, if you are stretching your neck, I would recommend this, which I would call range of motion. I would not call it stretching. I would do this. So, as I previously mentioned, we've mentioned this in a lot of other videos, is the importance of doing foam roller stretching in regards to opening ourselves up with gravity. I'm going to go ahead and plug this. In October, on October 12th and October 19th, you're going to want to join us live on those days. You can always come back and watch the recording, but we will be going through a workstation setup. We will be moving about the clinic, showing you how to make adjustments to your computer monitor, where you should be at sitting. And then on the 19th, we're actually going to do a much more interactive exercise class, so to speak, to show you the things that we practice when we practice what we preach, to avoid my thumb going numb, because I have a history of a neck issue, that we do to manage our shoulder issues, to give ourselves more breaks. We're going to actually show you and take you through our favorite postural break exercises on the 19th. Okay, so we'll get into more detail in regards to how to adjust your monitor, what your workstation setup should be. Also, if you want to be a part, I'm going to let you know this right here. If you want to be a part of the newsletter that we're sending out, please send us a personal message with your email address. Rachel will add you then to our email address. We'll be including some of those details. We'll be including a handout with the newsletter the week of October 12th, because that week we're going to send out what kind of a workstation checklist that you can go through to see if your computer screen is set up well, so that you're not like this, so that you're not bent forward. Now, again, there are some things that we can change and adjust on our either computer monitor, our chair, those kind of things. Some things we can't change, but we'll be giving you more details on that in the month of October. So make sure that you come back in October to get those things. And then, like I said, on October 19th, we will be then giving you specific exercises, specific things that we do to do that. So again, if you're interested in receiving our newsletter with our weekly tips, personal message us that. Rachel will add you to our newsletter because we want you to be getting those tips as well. So again, we've talked a little bit about what the shoulder blade pain looks like. Now, we can talk about migraines. We can talk about our kids sitting too much, all of those kind of things. A lot of them are really pretty much connected. And there's so many consistent contributing factors, whether we're kids sitting too much, staring at our screens, all of that kind of stuff, that the approach to it is very similar. However, again, differentiating between a nerve creating the problem or just a muscle creating the problem, where the nerve isn't overexciting the muscle, these are things that we have to figure out the difference between, because it does make a big difference in how we approach your home exercise program, in addition to how we address your manual therapy. Okay, so we are a manual therapy clinic, meaning very hands-on. And it's something that I've been a therapist for a couple decades, and incorporating my hands into the treatment is probably one of the most important things we do, which is to me the definition of skilled physical therapy. Now, as time goes on, when we're working with somebody, sure, you need our hands less and less. And as I like to joke, you can't take our hands home with you. Okay? So you eventually need to be independent enough in regards to your exercises and managing your symptoms on your own, or completely getting them to go away without taking these bad boys home with you. Okay? However, when a muscle is tight, which is what we talked about, and that may not just be that upper trap levator scap here, if we're tight in the base of our skull, if we are tight in our joints between our shoulder blades, the traditional hunchback area, if we're having those kind of things, we need to get in there and actually loosen them up. We need to create blood flow. We need circulation, all this kind of stuff, right, that works out the junk and allows us to retrain how those muscles should be working, that those joints should move. Something that is often forgotten, and I will mention this across the board, is the importance not just of neck extension, but of thoracic extension. Okay, so your let's spit that right out, friends. The thoracic spine goes from just at the kind of where you get that little knob there, where the bottom of your neck, down to, oh, sorry, men, but just below the bra line. The middle of your spine, the thoracic spine, is very much responsible for rotation. Okay, it is also for protection, because your thoracic spine, all your ribs connect to your thoracic spine, which protects your organs. And there's also side bending. Okay, we get all that motion. Now, what can happen, again, the effects of gravity. If we are too far forward because our head weighs too much, because we're not getting enough muscle support, we will start to get rounded. And when we mentioned the hunchback position, that is something, when we lose motion, that is without a doubt a use it or lose it scenario. So you need extension to allow you to open up. How do we do that? Well, admittedly, you can just bend over the back of your chair to get some extension. However, to be more intentional and to do it with more control, this is where the foam roller comes in. So we love to do chest stretching on the foam roller, where you lay on it from head to tail. You allow everything to open up. You're getting the flexibility of the chest, but we're also getting, because we're laying flat on our back with our arms opened, with that, again, that foam roller laying on it from head to tail, all on our spine, we are allowing for our vertebral column to push forward, because gravity is opening it up. We are rounding around. We are going around the foam roller, and it allows motion to allow for extension in that mid back. So that is one position we do that. That is where we hold for 4 to 5 minutes, just allowing that mobility to happen slowly without forcing it. The other option then is you take that foam roller and you turn it perpendicular to your spine, and you lay flat on your back, and then again, while supporting your head, you arch or extend over that roller, and you allow that motion to happen. Because here's the thing, if you lose motion in the area, it does not matter how strong you are, You will be hunched over. Your head will have to make up for that. And now we're talking about long-term tension in the neck, and there's really no coming back from that. I'm always saddened to see there's a couple of older people that I'll see walking through Myers, and they're just leaning on the cart. They can't get themselves upright if they wanted to, and those joints have stopped moving. If you are somebody that has to have 2 or 3 pillows to sleep at night, make sure that you are able to lay flat on your back with that head position there. We on occasion have clients who come in to see us that are incapable of laying flat on their back because it creates too much pain and discomfort, either in their low back, their neck, or in their thoracic spine. Okay? So you need to make sure that you can lay flat. If everything continues to push you forward, you will be stuck there permanently. And that's not something that we want, because there is a lot of additional effects that play into that affects your ability of your lungs to expand. It affects the ability of you to see and drive, right? Because you need to be able to pick up your head. You lose loss of rotation in your neck when you're bent forward. You lose loss of shoulder motion when you're bent forward, which increases your risk of a rotator cuff tear or breakdown. So there are a lot of things that are connected then to the importance of thoracic extension and movement going backwards between those shoulder blades. So I hope that makes sense to you. We really need to make sure that that area of the body is working, moving, extending, because if it's not, everything kind of around it can start to have some problems. One other thing that we have mentioned this week in regards to preparing for this talk is the conversation of the migraine. Now, migraines are a very complicated process, a complicated symptom, varies greatly between lots of individuals. I know individuals who get migraines because of food. There are people who get migraines associated with their menstrual cycle and hormonal changes. But we have also seen people who have migraines, okay, long-lasting headaches that causes them to want to be in a dark room with no sound, eyes closed, all of those kind of things. But I do want to say that we have had success in treating migraine sufferers by addressing their neck and their shoulder issues and resolving their migraine or continuous presence of headaches through some of the stuff that we've already talked about: the manual therapy, the thoracic extension, the neck extension, the shoulder blade strengthening, the rotator cuff strengthening. So I push back, all right, I will push back on you without knowing your individual cases. That says, yes, some people do need to manage their migraines with medication. Sometimes it is connected to, again, hormones, diet, all those kind of things. However, it is very possible that you or somebody you know that is a migraine sufferer may have a mechanical cause of that reoccurring headache. Okay? Mechanical cause, which, if it is a mechanical cause of having migraines, of having repeated headaches, we would then investigate as physical therapists to range of motion, flexibility, strength, posture, nerve compression. The list goes on and on of all the things that we will screen, that we will look through to see if something is restricted. We want symmetrical equal motion. Can you turn your head to the right as far as you can turn your head to the left? Does it pinch? Does it increase symptoms down your arm? Can you look up freely? Can you look down freely? I can't. Honestly, I can't move freely because I have a history of my neck. I have to manage it at this point. And if it gets too much to manage, I will end up back on our physical therapy schedule to get the necessary manual therapy and, let's be honest, the accountability that I sometimes need to make sure that I'm doing the stuff that I need to do. Which, again, flexibility, strengthening of the shoulders, strengthening of the rotator cuff, getting those shoulder blades back. So we are looking for mechanical causes, and sometimes those mechanical causes can be isolated to a level or two in your neck. Can be because there's loss of motion in your thoracic spine. So if you are a regular migraine sufferer, or you know somebody that is, it may be worth a visit to our office to let us evaluate in detail and see if there's something going on. This weekend, I was talking to the kids that I'm actually a scientist because they were talking about things. What do they want to do when they get older? And I said, you know how when you talk about the scientific method, when you talk about coming up with a hypothesis, evaluated someone this morning And I developed a hypothesis based on their symptoms, based on what they've told me, based on my history of seeing many, many people like them. I create a hypothesis that says, with this individual, right? Let's say it was somebody comes in with pain down the right shoulder blade, right down the back, worse when they ride in the car, better when they lay flat on their back. I am making a determination that I think it might be a disc issue, that it's coming from the neck. And so what I do based on that hypothesis then we test it. We take the body through range of motion, manual muscle testing. We go through and touch everything. We check the ligaments. We do special testing. We do all of these kind of things to determine if my hypothesis over here is actually what we see. And so we're looking for things to be equal. We're looking for things to move in a normal pattern. And when we do that, we get to the end, most of the time, it's pretty straightforward what somebody has. And so that's where answers can be provided without necessarily jumping to the MRI. And like I mentioned earlier, we had gotten a question about a pinched nerve in the neck causing shoulder pain and numbness down the right arm. They did an MRI of the shoulder, which had nothing wrong with it. That's where the sooner you can get to physical therapy, I really truly believe this. Numbness and tingling shouldn't be put off. If you can't get it to get under control in a couple of days, I highly recommend going to a skilled physical therapist. Of course, we have a team of those here at Nephew who evaluate you to figure out what's causing it. Of course, you need to be icing. You need to be icing your neck, okay? Not where that numbness and tingling is going, not your shoulder blade. Ice your neck, because I know I can tell you to ice your neck and it's not going to do any damage. Good icing is 10 to 15 minutes, by the way, not 2 to 3 hours, and you're giving a break in between when we have those kind of situations, because you need to calm down the inflammation. And icing, local icing, is what's best for that. Yes, I know heat often feels better, and for those of you who have hot tubs, I totally get it. But when we are inflamed and pain is traveling, you need to get to the root of that with the ice, okay? So that's where we make those hypotheses, we make some assumptions, but then we test it, all right? And like the person this morning, which wasn't a neck or a shoulder, I will tell you, but my hypothesis proved to be true. She was weak in the muscles. I assumed she was weakened. She was asymmetrical. Her alignment was off. Her flexibility was off. Her strength was off. She was crooked. And the fact that that area of her body was crooked was very likely contributing to the pain, the discomfort, and the lack of strength that she so greatly needed to be able to do the everyday activities that were so important to her. You know, this weekend, and some of you who are watching may know this, but somebody that I care about deeply, a couple of people I know, were rear-ended. They were stopped at a stop sign and ran into by somebody who didn't even touch the brakes. And I can say that they are doing well, and I am grateful for that. But whether it's an acute injury like that, where you have whiplash, whether it's you slept wrong, whether it's, slept on the couch, woke up the next morning, arm going numb after playing softball, my story. The first thing you need to do is ice. Now, I'm going to say something that is outside the scope of my license. And so here is my warning, friends. If I'm Melissa, your friend, I'm giving you this advice. Physical therapist, no, it's not covered by my license. There is something to be said about proactively using some ibuprofen. If you can't tolerate that, Tylenol. Talk to your doctor. Read the recommendations on the side of the box. Here's all my disclaimers. Don't sue me because I told you to do this. But what I do know is that ibuprofen addresses inflammation. And when we go through something traumatic, right, like whiplash from being rear-ended, like falling asleep on the couch like this overnight and causing everything to get inflamed, we need to calm down the inflammation. And honestly, in modern day medicine, the fastest and quickest way to do that is icing and possibly taking that ibuprofen. So again, I'm not telling you to take ibuprofen, one, if you can't, because your body can't handle it. But if you have safely used ibuprofen before, I think the fancy term is prophylactically, preventatively, you need to get that inflammation down, okay? Because waking up the next morning, which is usually what happens, whether you spent the full day lifting and moving concrete because you helped your friends take down their chimney, if you've gotten a car accident, I don't care what it is, icing proactively after that, extensions proactively after bending and lifting, all of that kind of stuff is going to hopefully then make the next morning or if you're like me, 2 days later, not to be so flared up and in so much pain. Okay? So this is where don't wait to see what tomorrow brings. Okay? Don't wait too long to have somebody look at your neck. Don't think that migraines need to be a normal part of your life. Sure, for some people they are. But have you really done a deep investigation? Forgive me here, but not all physical therapy is the same, right? Not all doctors are the same. People get second opinions all the time. Okay? And the only reason I can confidently say that is because we do have clients that say this is very different than what I've experienced before. You know, I really just want to see our profession elevated. I want to see us to work harder for our clients. I want to see us do more hands-on therapy. I want our clients to get more one-on-one attention. Sending you off to the corner to ride the elliptical for 30 minutes and then 10 minutes on the bike where nobody is walking alongside of you, educating you, telling you to engage your glutes more, getting you doing some scaled squatting, not just go do that exercise and come back and tell me when you're done. This direct attention, because let's be honest, the human body is amazing at compensating. If it wasn't, none of us would be walking upright. Let's be honest. I mean, it's amazing I can survive without my gallbladder and my appendix because the body can compensate. It's amazing how I can be upright because of my bulging disc in my neck that I have to manage, because I sprained my ankle, because, you know, the list goes on. We all had different things that have definitely caused us to not move normal. But when we are in pain, when we are weak, we need skilled, trained, super picky eyes to make sure that we are waking up the muscles that are weak, that we are not overcompensating with the muscles that are too strong, that we are making everything work the way it was designed to work by our Creator. So keep that in mind, friends, is that we need to be proactive. Thanks, Jeff. Yes, right on. We need skilled, pay attention, picky. Let us yell at you. Let us make fun of you together. Okay, sorry. But you need that attention. If it's just something that you could do at home on your own and you're doing just fine, if it's boring, if it's too easy, we don't do it. There's this joke, don't tell your therapist that something's easy. We'll make it harder. But we want to make sure that we're hitting those targeted muscles. That's why this morning with some of our patients, when I got them started today, they're super strong people, but they're doing stuff on their back and laying on their side, because if I started them standing up, they would compensate with everything. Doing this actually takes a fair amount of coordination. So we often start chin tucks, or that extension, as we're talking about next today, on your back, because then you're not using your whole body to be working on that extension, okay? Because the body is made to compensate. It's made to cheat. So keep that in mind, friends. So in closing, okay, number 1, neck pain, not normal. Number 2, numbness and tingling down the arm, very bad. Number 3, skilled physical therapy. They're not all the same. Make sure you're working with a therapist that is watching what you're doing, tweaking what you're doing, that you have good homework, but that there's good follow through. And remember, you have a choice for where you go. Okay? I just want to make sure that everybody knows that you have a choice in what physician you go to. You have a choice in where you get your x-rays. You have a choice in where you get your blood work. You have a choice in where you get your physical therapy. Yes, your physician may have a favorite, but if you already have a relationship with a physical therapy practice, and again, this is to any of my friends around the country, you have a choice. God bless America. We still have choice in most areas of our lives. We need to choose where we go. Build that relationship. Find somebody that you trust. If you don't trust where you're going, you need to go shopping. You need to have somebody that you trust. You need to have a primary care provider, whether that's your physician's assistant, whether that's your a medical doctor, a DO, or a nurse practitioner. Your primary care provider needs to be somebody you trust, that you can work with together. All right, I'll step off my soapbox here in just a second. All right, well, thank you again, everybody, for joining us today. I wanted to remind you that on October 12th, we will be doing a walkthrough in our building, doing some live interactive work with some of our team members and with myself in regards to how we're setting up our workstations, our computer workstations. With that, our newsletter that week will include a computer workstation setup. So if you'd like to get that, feel free to send us a personal message here on Facebook or on Instagram, giving us your email address, and we'll make sure we add you to our weekly newsletter. On the 19th, we will be doing some of our favorite postural exercises postural break exercises, things that we do to take a break from that rounded forward horrible posture that bothers our neck and shoulders, which is one of the most common things we're dealing with. This is also beneficial for your children, by the way, things you could do with your kids if they're stuck, staring at a device more than they used to. So on the 19th, we'll be going through that. So wanted to make sure that you guys knew those things. If you have any further questions about any future topics, or you have a specific question you'd like to ask, send us a message here on Facebook or Instagram. We're interacting with our clients on a regular basis here. We're in real time trying to provide them with some clues or some tips on what they can do. But always know you can come to physical therapy here at Nephew Physical Therapy without a referral. Yes, your insurance will cover it. Yes, we will still coordinate with your physician. And yes, we will provide you with a very picky exercise program and a plan to get you out of pain. Thanks for joining us. Melissa Meiste here from Nephew Physical Therapy, reminding you neck pain is not normal. Do something about it.